How long do I need to wait after a facelift to get skin treatments like peels, microdermabrasion, etc.?
Thank you for your question. You're asking a question about how long to wait after a facelift for procedures like microdermabrasion and peels for your skin. Well, certainly I can give you some guidance as to how to make that decision based on my experience and how I guide my own patients. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I performed the full range of facelifting surgery, everything from suture suspension, surgical procedures, all the way to standard SMAS lifting, as well as on the more advanced and deep plane facelifting with facial implants and fat grafting. So there's a wide, I think the point of explaining that to you helps you understand that the answer to your question is, it depends. And what does it depend on? Well, it depends on two variables. One is, how extensive is the undermining of the skin of the facelift procedure you're going to undergo? And the second question is, what is your goal with those peels and microdermabrasion? You see, a lot of times people who are good candidates for facelifting surgery are also people who are good candidates for some type of skin rejuvenation procedure at the time of surgery. And how that's determined is based on several factors, but one very important factor is the level of surgery that's being performed. So, for example, if you're getting a procedure, a short scar facelift, like an S lift or a max lift, suture suspension lift, then not much of the skin is being separated from the underlying tissue. So, if that's the case, then you can probably be more aggressive about when you can resume these types of treatments. If you're having a more extensive procedure, I would say you want to wait longer. Another issue with this is that when you have, let's say, something that's more of a traditional facelifting procedure, let's use that kind of like as the happy medium. If you're doing a more traditional facelifting procedure, very often you're undermining not just the face, but also the neck to get a face and neck lift. A lot of times this area becomes numb temporarily during the healing process. So the feedback of being able to tell whoever is doing a procedure about how something feels won't be there. So in a worst case scenario situation, if you're having somebody do an aggressive, let's say an esthetician, doing an aggressive microdermabrasion on an area where there's numbness and you still don't have return of blood supply, you can imagine that can be a problem with the healing process. So in general, I tell people that allow swelling to resolve, and to a degree which is within, typically within the first month. And I would say you would take it very, very light and have your surgeon guide you. In my practice, we have all services under one roof. We have everything from skincare products to a spa where we do light peels, treatments like hydrofacials, and we have the full gamut of lasers, from fractional to fully ablative laser resurfacing, both erbium and CO2. So when it's within our own facility, I'm able to be hands-on and guide the skincare afterwards. But generally, I tend to be more on the conservative side, and I say wait a little bit before doing something more invasive than just using a good cleanser, a good moisturizer, and maybe something like in the retinol family for some cell renewal and superficial skin renewal type of treatment. So you have to kind of, since you didn't provide a photo, the questions you have to ask yourself is, what are you trying to achieve with those peels and microdermabrasion? I would suspect it's likely to just maintain a good, healthy complexion. When you have a facelifting procedure, that is typically something that is separate from the actual procedure itself, but you want to maybe discuss with your surgeon what your skincare plans would be afterwards. If your surgeon doesn't get involved in that type of that level of aftercare, then I would say just get some guidance, and then most likely your surgeon will want to be conservative and maybe wait even longer before they're comfortable. Again, it matters a lot on what your outcome is and how extensive the undermining of the skin is. Discuss that with your surgeon and then move forward with a more comprehensive plan. So I hope that was helpful. I wish you the best of luck. Thank you for your question.